Good afternoon, everyone. My name is Lisa Hale, and because I speak very fast and I get excited when I see patients, I have written everything down, so I make sure I get everything for you. I am honored to be with you today. I'm a clinical social worker. What does that mean? I work with incredible people like Dr. O'Reilly, Dr. Laura, Dr. Sylvette, and Zoe. And I work to provide the resources and counseling and all the support that you need outside of clinic. And I'm excited. I have been doing this for the past 7 years. And the group that I learn the most from every minute of every day is you. So I'm here to share a story with you today about my clinic, my Dr. Laura, my Dr. Sylvette, and my Zoe, and how we learned and grew because of HD patients. My world is in Vanderbilt. It's in Nashville, Tennessee. Yes, it's the home of country music. But I want to share with you this story of how our patients, our caregivers, our children, our adolescents, and our young adults taught us in our care team. My Dr. Laura is Dr. Daniel, and we learned the power of social connections and the power of family. Works to be in this part of the world. I first started in 2013 as an intern, a graduate intern in the HD clinic. And I had a very lovely young man who was 16 years old. He was super excited. He had just gotten his first car. It was a Mustang, and it was beautiful. And he had miswired and misplaced his spark plugs, and he blew up his transmission. And he was so very sad as he was sharing it with us in clinic. And I watched my neurologist, Dr. Daniel, come out and work with our social worker and say, we need to help this young man. How do we work with his school? How do we work with his family? How do we work to help him be the very best that he can be? And at that moment, in that time, I knew I wanted to be part of that team. I didn't know how I was going to do it, but that was my goal. So I walk beside you as someone who is not impacted by HD. I don't walk in your shoes, but I walk beside you every moment of every day. And I'm proud to share this story with you today. Fresh out of graduate school in 2016, my HD journey began. I carried the largest notebook I could physically find, and I carefully wrote down every single thing I could learn from neurologists, nurses, speech pathologists, and every young PhD student I could buy lunch for so they could explain to me the language of medical, the language of Vanderbilt, and the language of HD. I reached out to every advocacy organization to receive their materials and to learn how they could support my patients, and quickly became a member of the Huntington Study Group so that I could be part of the longitudinal study called Enroll HD. I had two wonderful women on speed dial. I call them the mothers of HD, Dr. Mary Edmondson and Dr. Martha Nance. And I consulted with them on every difficult case and listened to every word of anyone that could teach me so that I could support my patients and family members. We facilitated our first Huntington Study Group meeting in Nashville, 1,500 incredible scientists, all in one room, of which I was terrified. And we successfully became what's called the Level 1 Center of Excellence. But none of this, and I repeat to you, none of this prepared us for the most important lesson of all. In July of 2017, I received a call from HDO, the Huntington's Disease Youth Organization, asking if I could be part of the clinical staff team at an HDO camp with 52 young adults, ages 15 to 23, in what would be 90-degree heat, 90% humidity, in a rustic Catholic youth organization camp. Oh, by the way, no air conditioning either. Curious, because I knew what I didn't know. I thought I did. I said, I'm in, I'll go. What I learned from this youth camp was so simple, but yet so eloquent. This yearly camp provided young adults, ages 15 to 23, a safe space where they were recognized for who they were as individuals versus supports for their families impacted by HD. Many of these young adults, for the first time, were part of a group their own age. They were able to learn about HD from their peers, to understand they were not alone, but part of a group that understood what it's like for your loved ones to be impacted by HD. The challenges of caring for patients, being at risk, often isolated and alone. These young adults were able to find someone to honestly share their hopes, their fears, and their dreams. They found a safe space to be vulnerable, to learn, to grow, and develop relationships that would be maintained long after camp, providing a lifeline during the challenging times of being alone and also being part of an HD family. All things that honestly in 2017 were not being addressed in our clinic. Post HDO camp, I fearlessly came back to my director, Dr. Daniel Klossman, and said, hey, we think we're supporting families, but we're not. We truly had a gap in care. Specifically, we did not identify or support adolescents and young adults. And let me be clear, because everybody has a different definition for adolescents and young adults. In our world, it was from 15 to 39, okay? Fast forward 14 months later, in October of 2018, with the generous support of the Griffin Foundation and a new collaboration with the Stress and Coping Lab at Vanderbilt, our youth and family study began with a large and diverse team of collaborators ranging from psychologists, social workers, neurologists, and doctoral students at Vanderbilt. At the time, there wasn't a lot known about what is stressful for families, how family members cope with the stresses that they experience, or how, or even if they talk about it as a family. This was a bit surprising, considering that HD affects the family across generations, as each and every one of you know. Using the best methods we have through behavioral science in the field of psychology, we set out to understand what is stressful for families, including what is stressful for patients, for spouses, for caregivers, and children, teens and young adults. How do members of a family cope with the stress and emotions they experience, both in ways that are helpful and sometimes maybe ways that are not so helpful, and try to understand if and how families talk about HD and what might make it hard to talk about it together. Conversely, what makes it easier? We invited parents and children with HD to participate with their spouses and children. The point was, we knew HD impacts everyone differently, but for us to truly understand it, we did not want to sit in a room as a part of experts and say, this is how you are impacted. We wanted to ask you directly. And the only way to do that was to provide a study for you to come in. As you've heard from Elaine and Dr. Arati, this is called an observational study. So we ask families to complete surveys online about stress in their lives, how they cope with it, and the varying emotions and behaviors they experience. We also ask parents and their children to come and do some tasks in person. They had to do some tasks on an iPad, pretty simple, as well as having 2 taped video conversations. One conversation was to talk about a very pleasant experience they had. The second conversation was to talk about difficulties faced by HD. This was a tough sell. Most families were very much into it, and other families who maybe hadn't had that conversation before weren't that excited. We wanted to learn as much as physically possible from these families as we were trying to understand as many experiences as possible. More importantly, we wanted to meet each patient, each caregiver, and each young adult where they were. We did not want to put words in their mouth. We wanted to learn from them. We also know that no 2 families do the same, and the only way to provide a therapy and help was to understand the many diverse and important stories that patients had to offer. From October 18th to April of 21, we enrolled 50 families with 84 children. Note that some of the data collection was during COVID, but our families were resilient and wonderful, as you all are here today, and helped to support this. We were fortunate and honored to obtain funding from Jack Griffin and CHDI Foundation in early 2021 to enroll even more families. The goal of this support was to continue to learn from families and take what we learned to develop a family-based program. Note, a family-based program to support families and, more importantly, to build resilience, to give you the supports to thrive throughout the journey of HD. With the support from these funders, we enrolled additional 31 families and 46 children in less than 1 year, for a total of 81 families and 130 children. We have been fortunate to establish strong relationships with many of the families, and they have come back to us multiple times so that we can continue to learn and grow from their experiences over a long-term time frame. There is much more work to come and many more things to be learned, but a few highlights of the things we have learned. As you see on this chart, there are many parts of HD that family members find stressful, and not everyone experiences the same parts as equally stressful. The sources of stress for patients is not the same as the sources for stress for children and spouses. On a survey, highlights of which each group finds stressful is shown for you here. Patients worry about what affects the family, their future, finances, loss of independence, isolation, and growing up as a family, as part of a family affected by HD. Spouses and caretakers have a whole different set of worries, taking on greater responsibilities, finances, concerns about their child's risk for HD, isolation, oftentimes a chaotic home, and caregiver burden. Children have greater responsibilities for their future. Oftentimes, these children are caregivers. They're worried about judgments from others, about their family, in their community, in their church, in their school. Life for them often feels out of control, and the smile may be on their face. They are oftentimes isolated at school and at work. There are a lot of ways people can cope with stress. The basic tenet of good coping is control what you can and accept what you cannot. There is indication that this is also true for the stresses of Huntington's disease. The coping strategies that involve moving forward toward the source of stress or engaging with one's emotions through active means such as problem solving, acceptance, and expressing emotions in a controlled, regulated way is related to less depression and anxiety for parents, children, and spouses. This is in contrast to coping strategies that involve withdrawing, avoiding, and denying the existence of a stressor. There is evidence that how family members cope with their experience affects how they communicate. Family members who use more active coping strategies, i.e., acceptance and problem solving, also tend to listen more sensitively and communicate more effectively with their family members when talking about HD. Family members who use more avoidance and denial to cope with HD stress tend to be more hostile toward their family members, talk less about their experiences, and listen less attentively to their family members. We have also begun to learn about the importance of connection and community that's in this room right now. Family members who feel socially connected to others around them tend to experience less negative emotions and more positive emotions. Families who are isolated tend to experience more anxiety and depression. Decades of research before us have shown that stress, coping, and communication are great targets for intervention. Based on the lessons learned and the information from our HD families, we have developed an 8-week, 1 hour per week program that builds skills and resilience in families impacted by Huntington's disease. These sessions focus on identifying the sources of stress families experience and actively working one-on-one with family members to build coping skills that include acceptance, problem solving, cognitive reframing, as well as supporting communication skills, and most important of all, the beauty of social connection. We are actively piloting the program with 20 HD families who are a part of our clinic. We will take their feedback and experiences and improve the program even more. And it's my hope and dream that we then will be able to provide this to other HD clinics. And I'm looking at the foundation and I hope that we're able to bring it to, and I'm so excited. I'm one of the facilitators. I'm on session 4. And the most beautiful thing that I have seen is that a mother and daughter each chose to be in their own sessions so they could process their own feelings independently and be able to say what's on their heart. But they cheat and they compare notes in between sessions. So one parent in the first session, the mother's, I don't get my daughter. She's very different than I am. And I'm like, I can relate to that. And that was Monday night. On Wednesday night, I hear from the daughter. We're comparing notes. Is that okay? Is that per the protocol? And I'm like, it's what's expected. This is all good. By session number 3, the daughter was saying, I now see my mother as a beautiful human being and not just a caretaker. I see her for who she is. I see her for what she does. And I recognize that I did not see her in that light before. That's when this crazy social worker started crying. It was pretty cool. So we have 5 more sessions to go. And we are honored to hopefully give them to every center of excellence, every advocacy organization. And my dream is to teach social workers to be able to facilitate this. So you are the first group that we've shared this information with. I thank you so very, very much. Final in April, I get you over 50 readers. In April of 2022, we received over $3 million from the National Institute of Child Health and Human Development. And research speak, it's an R01. I still don't know what that means. To continue to learn from our families with a specific focus on the importance of social connection, on our physical and mental well-being. We will continue to invite families to participate over the next 4 years with the goal of enrolling 200 families who will ask to come back annually for 3 years. Thank you so much for your time today. Questions do you have? Yes.
Why do you think that Hale will be implemented here in Puerto Rico?
If I had my way, I would do it. But what's gonna happen is we have to finish our pilot program. And we have to get the input from all of our family members. My phrase in the clinic is what's good, what's bad, and what's flat ugly that we need to fix. So we're taking all that input and we're going to revise it. And then we will work on disseminating that. So hopefully in the next 6 months. But I went to the foundation yesterday and had an incredible tour. And I have now seen all your beautiful faces. So you are now in our hearts. And you will be one of the first centers.
Thank you for all you do.
Hello. I want to thank you for letting someone so far away come be part of your world. I appreciate how private this is for so many of you, and to let someone you don't know from a university so far away to come be part of your world today means everything, because you became vulnerable to let us come be part of your world. And I thank you from the bottom of my heart. Foundation Huntington, Puerto Rico, for HD, who I love and adore. And most of all, each of you for letting me share our story with you and be a part of your journey.